Rules Committee will come to order, and good evening, and thank you for joining us. Today, the Rules Committee will consider H.R. 3762, the Restoring America's Healthcare Freedom Reconciliation Act of 2015. This bill represents not only a lot of great and hard work by many of our committee chairmen, but the work done by Chairman John Klein and the Education and Workforce Committee, Chairman Fred Upton, Energy and Commerce Committee, Chairman Paul Ryan of the Ways and Means Committee to approve reconciliation recommendations in accordance with instructions to our young budget chairman, Tom Price, the chairman of our budget committee from Georgia, to the FY 2016 budget resolution. The budget committee has studied the work and has put together one unified reconciliation bill with recommendations which, when put together, would dismantle Obamacare, invest in women's health care, and defend our culture of life. There are limitations to reconciliation, which is why Chairman Tom Price has worked with the committees of jurisdiction and the Rules Committee to craft a package that can get past this committee, past the floor, get to the Senate, and make it to the President's desk. We believe that process is important, and Tom Price has given us the confidence to understand that if we work diligently at this effort, we'll have a chance to engage the President of the United States for full options that are available not only to the House and the Senate, the President of the United States and the American people to know where we stand on these important issues. Joining Chairman Price today is Ranking Member Van Hollen, who spoke with me on the floor. Chris indicated that he might be early, he might be late, or he might not be here at all. But that's okay. The gentleman, Mr. Yarmouth, is from Kentucky, is very capable of standing in his place. I notified the ranking member, Mrs. Slaughter, and the gentleman from Massachusetts that you quite likely would be here, and that Mr. Van Hollen graciously might need to leave a little bit early. We might see him, and he's sticking his head in right now. So we have really started this properly. So the gentleman, I'd like to ask that Chairman Price and Mr. Van Hollen both come up to the table. And at any time that Mr. Van Hollen chooses to switch out, I want to thank you both for taking time to be here today. Without objection, anything you have in writing will be in the record. But the most important part for us to remember today is we're going to have votes in a few minutes. We'd like to get through your testimony before we have to go vote. So we'll take all the time that's necessary. We want to make sure we hear from both of you. And I'd like to yield at this time to the awesome ranking member that we have, the gentleman from New York. She's recognized. Yes, Louise, that's you.
Thank you, Mr. Chairman. Gentlemen, good afternoon. Happy to see you here. I can't help but mention that the chairman says that he wants the American people to know where you stand. And given that this is the 61st event here trying to kill health care for the American people, I'm pretty sure they know where you stand. But now you've added to this the defunding of Planned Parenthood, which provides health care for 1 in 5 American women. 1 in 5. And it's absolutely, I don't think anybody in the world has escaped that notice, but I know your chronology is that it will pass here and it will pass the Senate, but you got some bird rule problems that I understand. And then we'll go to the president, but as you and I, we all know that's the end of it. So I guess we'll come back then and do the 60-second vote. So far we haven't had a thing to replace that with, and I'm very much concerned because actually 16 million people would lose their health care, including a lot of children. Pre-existing conditions would come back. 8 states, including and the District of Columbia, would say that it's okay to beat up people and that domestic violence is a pre-existing condition, as it did before this bill passed. But Planned Parenthood, everybody knows that not a dime of federal money goes into abortions. It hasn't since the 70s. And the people, men and women, who go to Planned Parenthood for their cancer screening, for their health care, STD tests, breast cancer, to just say to them, we're sorry, we just don't believe it's good for the country for you people to go ahead and exist. So I'm anxious to hear from both of you, but I have to tell you, I'm skeptical. I've gone through this so many times. I hesitate to think how much it costs the taxpayers to vote this thing up and down, out, in and out, upside down 61 times, but I know that the price is really adding up. And given the fact that this is a country without a budget, and for the first time in my memory being here, we have no highway bill. We absolutely don't know where we're going. You guys don't have a speaker. So it's pretty grim around here, but I guess we will just keep doing the same thing over and over again. And someday we'll stop because we understand that it hurts if we keep beating our head against that wall. So with that good news, I will say again how nice to have you all here. And let's have at it one more time. I yield back.
Gentlewoman yields back her time. Thank you very much. In fact, we, as you probably know, spend a great deal of time up here. We have an expert from the Energy and Commerce Committee, a guy named Mike Burgess, really cool guy, who understands not only the implications of it, but this week we'll be going home for town hall meetings and hearing from people that are on Medicare but have not gone to Social Security yet, who will be seeing their prices jump by 50% because of the $700 billion that was taken out of Medicare by Obamacare. So I think it's a current topic and one which does involve not only a good discussion about what we do, how we deal with the money, but it comes right out of the Budget Committee, and both of you are very able and expert. I see the gentleman, Tom Kahn, a dear friend of mine who assists Mr. Van Hollen, so I know Chris is ginned up for this, but I know, Tom, you probably studied last night till late, so let's just go straight to this testimony. The gentleman from Georgia, the young chairman, is recognized.
Thank you so much, and thanks to the ranking member and the members of the committee for allowing us to come and present this piece of legislation. It's good to be back with you.
Yes, sir.
Always good to be in the Rules Committee. I come before you today to discuss H.R. 3762, the Restoring Americans Health Care Freedom Reconciliation Act of 2015. This legislation repeals major pillars of Obamacare while reducing the deficit by nearly $130 billion over 10 years. It'll go a long way toward protecting patients and doctors and families and hardworking Americans and job creators and our economy from the negative consequences of Obamacare. And it'll begin to lay the foundation for patient-centered health care where patients and families and doctors are making medical decisions and not Washington, D.C. We're here today because earlier this year, for the first time in over a decade, Congress successfully adopted a 10-year bicameral balanced budget agreement. It is a budget that puts forth a bold vision for how we can solve the fiscal and economic challenges facing America and ensure greater opportunity and security for years to come. That effort is also made possible for us to utilize a powerful budget process tool called reconciliation, through which we can now move legislation through the House and through the Senate and to the President's desk in an expedited manner. The reconciliation instructions included in our budget tasked 3 committees in the House of Representatives to submit legislation identifying Obamacare while reducing the deficit. And I want to thank the House Ways and Means Committee, the Energy and Commerce Committee, Education and Workforce Committee, their chairman and their members for being an essential part of this process. Under the Budget Act, the House Budget Committee is then tasked with combining those submissions together into a single piece of legislation. And that's what we have done, and that's the bill that's before us today. This legislation repeals punitive taxes and mandates, as well as undue demands on employers and employees, while eliminating the Obamacare slush fund. Additionally, the bill prohibits for 1 year taxpayer dollars being used to pay abortion providers that are prohibited under the legislation, while increasing resources to community health centers for women's health in both FY16 and fiscal year 17 by $235 million each year. That's an increase in the amount of resources available for women's health, not a decrease. The Obamacare provisions targeted in this bill are directly responsible for the coercive nature of this law, and they are also within the scope of the reconciliation process. It's important for all of us to remember that the reconciliation is a powerful tool, but it's a limited budgetary tool. It's no silver bullet, and in order to ensure the success of this effort, we must respect those limitations. To that end, I come before the committee today to propose an amendment to this legislation in order to ensure that the process is able to move forward in a positive manner in the Senate. The amendment makes 2 changes to the underlying bill. It restores the original text that was voted out of the Energy and Commerce Committee relating to federal funds available to a state for payments. This was a result of a clerical error when the Energy and Commerce Committee reported to the Budget Committee. It also amends the Ways and Means title. That amendment would strike subtitle B of Title III that repeals the Independent Payment Advisory Board. This is in response to a decision by the Senate parliamentarian stating that this provision is being removed from the bill in order to preserve the reconciliation bill's special status in the Senate. At the end of the day, though, this conversation is about far more than process. It's about protecting the American people's access to quality, affordable, and innovative health care choices. It's about protecting entrepreneurs and workers from unnecessary burdens that will only exacerbate the economic challenges that we face today. This bill, the Restoring Americans Health Care Freedom and Reconciliation Act, goes a long way toward achieving those goals, and it does so while saving the American taxpayers nearly $130 billion over 10 years. So I thank you, Chairman Sessions, Ranking Member Slaughter. Thank you so much for the opportunity to address the committee and for the role that you play in this important endeavor. And I urge my colleagues to support this effort, and I look forward to working together to ensure that we continue to focus on building a stronger, more secure future for our great nation. I yield back.
Mr. Chairman, thank you very much. Ms. Van Hollen, we're delighted that you're here, and the gentleman's recognized.
Thank you, Mr. Chairman. Thank you, and Ranking Member Slaughter, other members of the committee. And I want to thank the Chairman of the Budget Committee because while we disagree strongly on these budget issues and this legislation, I will elaborate further. I appreciate the manner in which he has run the Budget Committee, so I appreciate that. But, and Mr. Chairman, I wasn't that worked up until your opening comments where you mentioned that Mr. Burgess was going to go to Florida and talk about the increase in the Medicare payments, which I think most people in this room know have nothing to do with the Affordable Care Act. And in fact, the Affordable Care Act, by ending some of the overpayments to the managed care part, actually reduced overall the amount of premiums paid because Medicare beneficiaries pay a certain percent toward their Part B, a percent share of the overall costs. And since we reduced the overall costs, we were actually able to reduce that below what it would be. And we certainly are working hard to try and avoid those increases in Medicare premiums. And there's some legislation we would love to have you join, Mr. Chairman, that would accomplish those goals. Now, on this legislation, and the ranking member did a great job of laying out a lot of our concerns. We're here weeks away from having to deal with our full faith and credit of the United States. We don't want to default on the obligations our country has made to others. We've got to avoid a government shutdown, potentially looming in a couple months. And yet here we are for the 61st time facing legislation to dismantle the Affordable Care Act. The Congressional Budget Office has analyzed this bill and concluded that it would result in taking away affordable health care for 14 to 15 million Americans, 20% of those being children. Why we would want to take away affordable care to America's children and others who didn't have coverage before the Affordable Care Act, God knows, especially when we've never seen, as the ranking member said, any kind of alternative that would provide those 14 to 15 million people with some kind of affordable care. In addition, the attack on Planned Parenthood and other women's health programs flies in the face of the evidence that has been presented to date. And I would just quote from the chairman of the House Oversight Committee, Mr. Chavitz, when he was asked on national television whether there was any evidence, in his opinion, that Planned Parenthood had broken any law. No, I'm not suggesting they broke the law. He has repeated that conclusion since that time, and yet we see legislation designed to target a particular organization. Third, I noticed the chairman was careful in saying that this reduced the deficit over the 10-year window. The reality is, according to the Congressional Budget Office, if you go beyond the 10-year window, it will actually increase our national deficit. Now, I think everybody knows that drawing artificial windows on timelines for deficit is simply playing games. What we care about is the long run, and this legislation, according to the Congressional Budget Office, actually increases deficits over the longer term. I have offered or will offer, present to the committee, legislation in place of this called the Preventing Government Shutdown Act, and would ask the committee to make that in order because that addresses a real problem we've got coming up, which is the risk of a government shutdown and the disruption it would cause to our economy. That legislation would create a bipartisan and bicameral group to negotiate the lifting of the damaging sequester caps, but also has a fail-safe mechanism in the event we don't reach agreement to provide adequate investments in both defense and non-defense. So I really hope, Mr. Chairman, that we will begin to focus in the People's House on issues that people care about and not spend our time trying to once again repeal a piece of legislation that's providing affordable health care to others. And I appreciate the fact that before I came in the room, you relayed the fact because of the change in time of this committee hearing, I'm not going to be able to stay for it all, and I apologize for that. But I'm very pleased that Mr. Yarmuth can be here and will take over very shortly for me. Thank you.
Thank you very much, Mr. Van Hollen. Mr. Chairman, there's discussion that you're just going to take away all the health care from people and that it's going to just cause this collapse. What more specifically really are you aiming at doing with this reconciliation bill?
Well, thank you. It's important for folks to note and appreciate that a majority of the American people continue to be opposed to the path that we're on in terms of health care. And as a formerly practicing physician, I have to step back and say, well, why is that? Why is it that 4 or 5 years into this process, into this new law, are a majority of the American people still opposed to what is touted by our friends on the other side of the aisle as the be-all and the end-all when it comes to health care? And let me just respectfully suggest that the principles of health care that all of us hold dear, regardless of our ideological stripe, are violated. We all want a system that's accessible for everybody. We want a system that's affordable for everybody. We want a system of the highest quality, one that has more choices for patients. And every single one of those principles is violated by the current law. And that's why the American people are opposed. So what we believe is the imperative of responding to the people's concerns about this law, and therefore bringing forth what we're able to do in reconciliation. And the reconciliation bill itself is in a vacuum because it must be because of the rules. But what we believe is that we ought to have patient-centered health care. Again, as I mentioned, where patients and families and doctors are making medical decisions and not your federal government. Where people are able to have the financial wherewithal to be able to purchase the coverage that they want, not that the government forces them to buy. And how we can save hundreds of billions of dollars in the area of health care with some robust lawsuit abuse reforms, solving the insurance challenges without putting Washington in charge of health care. There are wonderful positive solutions, and that's what we will be able to get to if we had an administration that actually thought that it was important to do what the people wanted and not what the administration wanted.
So this is a process that does not repeal all of the bill.
That's correct.
What does it do?
The different provisions that came from the Ways and Means Committee, the Energy and Commerce Committee, and the Education and Workforce Committee repeal the employer mandate under Obamacare, repeal the individual mandate under Obamacare, repeal the Cadillac tax, the tax on providing health coverage to many, many Americans, repeal the medical device tax, a tax that is harming innovation in this country and harming the quality of health care that's available for Americans all across this country. Repeals the slush fund that's been used by this administration in ways that were never, ever intended, and puts a moratorium on the amount of money available for organizations that have been involved in abortion services that are in question by so many of the American people across this land for the sale of fetal body parts. And we just think it's appropriate to step back and put a halt on that for the time being, while at the same time increasing monies, increasing resources available for women's health care and community health centers to a degree greater than the amount of money received by the organization in question.
Great. Mr. Van Hollen, these taxes, or it seems like that's what we're really trying to do away with here. Taxes that cause behavior on people that really are not even a part of the healthcare system and that recognize that many times the people who are on the healthcare have these huge deductibles that really have made it unimpressive and harder for people to get the coverage they thought they'd get. Did it work the way you thought it would work?
It is right on track in terms of reducing the number of insured in this country. As I indicated, the number of people who now have access to affordable health care who would not otherwise have had that.
What is that number?
18 million. And this
18.
18 million. And this legislation, according to the Congressional Budget Office, would take it away for 14 to 15 million of those 18 million people, including, as I said, 20% of them children. And, you know,
What would cause that for them to lose that?
because you're taking out major pieces of this legislation, including the individual mandate, which, as you recall, was something that the former governor of Massachusetts, Mitt Romney, pioneered, which was the notion that everybody should be at least partly responsible for getting their health care coverage, because otherwise people get sick, they go to the hospital, and if they don't have insurance, they're essentially asking the taxpayers to pick up the bill. So the idea was we should all take some responsibility for
So
it.
who's picking up the bill?
So right now, it's a combination of the premiums that are paid by individuals in the system, as well as through tax credits that are provided.
Taxpayer.
Yeah, but let me just be clear, Mr. Chairman. The largest portion of the revenue, the largest single portion of the revenue in the Affordable Care Act came from asking very wealthy people to pay a increase in to pay the Medicare fee, the Medicare tax, on their capital gains and on their unearned income. Because before that, the Medicare tax only applies to earned income. And one of the things we did was to say we think people who are making a lot of money should also participate in the Medicare program through their capital gains and unearned income. So if you look at the sources of revenue in the Affordable Care Act, the largest single source, as I say, is from very high income individuals to try to provide more affordable health care for middle income and working people.
And what has happened to insurance rates across the country since this time has happened?
Actually, insurance rates compared to the rate of increase prior to the Affordable Care Act have diminished dramatically. I think everybody on this committee understand, well, they have. They have. If you look at the period 2000 to 2008, you saw a doubling of premiums. You know, we get a lot of misinformation. People say, well, since the Affordable Care Act has passed, premiums gone up, healthcare costs have gone up. Healthcare costs have been going up forever. The issue has always been the rate of increase. How fast are they going up? And the reality is they're not going up as fast as they were, which is why, by the way, and for anybody who doubts it, you should look at the Congressional Budget Office reports. We've saved over $1 trillion over 10 years as a result of the Affordable Care Act and other changes in the healthcare system.
First time in 50 years that's happened?
Yes.
Since, and
Yeah,
I
yeah.
think that's very
So,
significant.
Look,
yeah.
I appreciate the good news, but the facts of the case are, I believe these individual Michael, what are they called? ACOs?
ACOs,
Affordable
Correct.
Care, or they're going broke. all
Accountable Care
across-
Organizations.
ACOs, Accountable Care Organization, going broke all over the country. And that's the word that I hope that gets out.
Mr.
too.
Chairman, it's important to look.
Certainly not happening in Maryland, so.
Well, I think you need to ask some of the people that are in Maryland and are paying higher rates for their insurance, and in fact, they are. And it's important to look at these numbers. The 18 million number cited is just fallacious. The 18 million number, by the way, includes all of us. Includes all the members of Congress who had coverage before in something different and were forced into Obamacare. It includes most of our staff that was forced into Obamacare. These were people that had coverage before. If you take out those folks, you're down to about 9 or 10 million, 12 million. If you take out the individuals that were already eligible for a program that was extant before, you're down to about 3 or 4 million. And we ought to be very, very pleased with the fact that there are 3 or 4 more million individuals that have health coverage. That's an important accomplishment. But the fact of the matter is there's a way to do this without turning the whole system upside down, increasing the cost for everybody, decreasing the accessibility, and decreasing the quality of care, which is what we're seeing all across this country, specifically because of this legislation, which is why this legislation, this bill right here, will dismantle the pillars of Obamacare in a way that the American people desire.
All right, one last question. Mr. Van Hollen, this is a great thing. This Affordable Care Act is awesome, right?
It's a good piece of legislation.
Good piece of legislation. Should this committee consider putting a provision in that would require this administration, all the government to go on the Affordable Care Act?
The whole purpose of the Affordable Care Act was to provide for people who did not have access to affordable care.
But members of Congress
a mechanism to get them because
Members of Congress
members
did.
of Congress decided.
Senator
members of Congress
Grassley.
decided.
Senator Grassley
and
did.
others.
So
Just be
what
clear.
I'm asking you is, this is so great, should the administration be on the Affordable Care Act?
It is great that people who didn't have access to affordable care now have access to affordable care. It never impacted major employers who already provided health care to their employees.
I will take that as a no. You do not believe that the administration should be on the Affordable Care Act?
I believe that people who don't have access to quality health care should have access to the Affordable Care Act, because that was what its purpose was all about. And
Well,
that's what
such a
it
good idea. We should all drink from that same cup of wine. Thank you very much. Gentleman from Georgia,
So I assume the chairman's for Medicare for all.
let me tell you what. In fact, the bottom line is that you're a witness before this committee, and I get a chance to ask you questions.
And I'm answering.
And I respect that very much, and I heard an answer that you did not believe they should.
Chairman, I did not
Well,
say that, but
what
I'll
did
let
the
the record
gentleman
stand
say?
where it was. I'll just let the record
Oh,
stand.
there you go. Then I was,
You want to read it back?
I-
You did not say that. You can't put that on the record.
all right, then I will put on the record, the gentleman said that it is there for people who do not
What the
have.
gentleman said. You don't have to interpret it
If the gentlewoman, you can jump in and help him on your time. I appreciate the gentleman being here, and I'll now move to the gentleman from Georgia.
Thank you, Mr. Chairman.
Thank you, Mr. Chairman. And thank you, Mr. Chairman, for giving me the opportunity to serve on the Budget Committee. Because you have named me as the Rules Committee designee to the Budget Committee, I get an opportunity to work with both of these gentlemen, who I say very sincerely I enjoy working with. I will miss Mr. Van Hollen when he is gone from the Budget Committee, but there are very capable hands sitting behind him today. I didn't intend to cover this ground, Mr. Chairman, but I'll ask you, since you're here, Mr. Van Hollen mentioned the 61st time we voted on repealing the President's health care bill. Of course, 9 of those times we passed it, the Senate passed it, the President signed it into law, because those were some very real problems that we needed to solve. But I think that misses what the good work the Budget Committee did. I know a lot of folks in my constituency really value that the federal government has stepped in and dealt with pre-existing conditions. We'd hope the states would. Many of the states didn't. Affordable Care Act abolished pre-existing conditions across the country. Is there anything in this legislation that repeals that ban on discriminating against pre-existing
There is
conditions?
not.
Another provision in the Affordable Care Act a lot of folks back home have enjoyed is being able to keep their unemployed children on their health care bill up until they're 26 years of age. Is there anything in this bill that abolishes the ability to keep your children on
There is
your
not.
plan? I say that to say that it really diminishes the work of the Budget Committee to suggest that what this is an attempt to dismantle the President's health care bill. In fact, the reconciliation process, though it was distorted to use to implement the President's health care bill, isn't about health care at all. It's about funding. It's about federal deficits. It's about providing for a secure economic future for the country. And the Budget Committee had very difficult work to do. I hope you both take some pride. It may be the 61st time that we're talking about the President's health care bill, but it's the first time in my 4.5 years of Congress we're talking about a reconciliation bill. I'm a little embarrassed to tell you that, but I'm going to tell you because you all share my shame. You share my shame. 4.5 years I've been a member of this body, and we've never had a budget that controlled the federal government of the United States of America. Now, with these two gentlemen in charge on the House side, with two very capable members in charge on the Senate side, for the first time since 2001, we have a balanced budget that has been passed by both houses of Congress, conferenced, and allows us to get into this process called reconciliation. I kind of thought we'd be doing it every year, and I hope we do it every year. You all have one more year to work at this together, and I hope you all are as successful next year as you have been this year. But we're talking about moving things to the president's desk. I wanted to ask, to the president's credit, he took on the labor unions, big funders of the Democratic Party, but he said, you know what, the health care you're providing to your members is too good. And we don't want folks to have health care that's good. And so if you continue to provide that, we're going to hit you with a 40% tax. This bill repeals that tax on health care plans that the president's Affordable Care Act said were too good. Is that right?
That's correct. In fact, that's a bipartisan initiative in this House. That's not the only bipartisan initiative that's included in this reconciliation.
So no longer, if this bill passes, if the president puts a signature on it, no longer will the federal government tell people their health care is too good and fine them for it. You'll be able to get as good a health care as your labor union or your employer would like to provide.
Correct.
Now, also in this bill, a 2.3% excise tax on medical innovations, on those life-saving technologies. I mean, we're the innovators for the world here. It excites me. Come on down to Georgia Tech anytime you all want to see some medical innovation. We've got it going on in Metro Atlanta. But 2.3% tax on anybody who comes up with any good ideas. In fact, all your old good ideas, we're going to tax you on those too. This bill repeals that tax on medical innovation?
It does, and it's important to appreciate that that's the first tax ever on gross receipts, not on profits, but on gross receipts. And so we believe that's a real harm to innovation all across this country.
Let me get this straight. If I have a not-for-profit idea, even if it's a for-profit idea, but things aren't going as well as I want to, if I'm distributing heart valves across the country, you're saying if I'm selling life-saving equipment to folks, I'm losing money on it because I'm selling it for less than cost? You hit me with this tax anyway.
Exactly. Gross receipts. It's the first time ever. It's just unconscionable.
But not if this bill passes.
Not if this bill passes. And the importance of this is that what we've done, what has been done by this administration is to decrease the level of innovation. And as a physician, I can tell you, and Dr. Burgess can tell you, the kinds of medical meetings, the technological medical meetings where the folks are pushing the envelope with their ideas about how to treat disease in individuals, those meetings are much more robust now outside of the United States, precisely because of this kind of thing. So we're losing right now quality health care. We're losing innovation right now. And this whole intent is to decrease the tax on individuals so that we can have the benefits of not having that tax, which is greater innovation, quality health care.
Now, I know that this reconciliation process allows you to move things through the Senate without a filibuster. It has been used as a tool of the majority in years past to move some pretty hyper-partisan pieces of legislation. When Mr. Van Hollen comes back to the table, I want to ask, in fairness, and I know you do not support the underlying bill, but would you also, as the chairman did, describe the repeal of the 40% excise tax on plans that the federal government deems are too generous for individuals? Would you view that repeal as an individual initiative as a bipartisan idea?
There is a piece of legislation. There's a bipartisan piece of legislation. Mr. Courtney from Connecticut is the lead sponsor, and I'm on that bill. I would like us to collectively find a way to cover the costs of that. But that was part of the Senate Affordable Health Care bill. It was never part of the original House bill, and many of us would have preferred a different way on that one piece. But as you know, Mr. Woodall, the reason the Congressional Budget Office is finding that this will take away health care to 14 to 15 million Americans has to do with the other provisions in this bill.
And similarly with the 2.3% excise tax repeal, again, innovation, supporters of job creation and healthcare innovation, that's not a partisan issue. I would have described that as a bipartisan initiative here in the House and in the Senate as well. Would you concur?
I do not believe that we should repeal that, and I'll tell you why. That provision was put in there actually in discussions with the industry at the time, who recognized that having 15, 16, 17, 18 million Americans who now had affordable health care, who would now benefit from being able to get those innovations and have them paid for, that at the end of the day, they would be doing even better. And they are doing just fine, by the way. And I do want to correct the record of the chairman, because members of Congress are not included and their staffs in that 18 million number. The 18 million number are people who did not have access to affordable care before, who have it today. Well, it is. Well, we'll just have to do a fact check on that.
Yep.
Okay?
It is, you know, it's easy to get twisted around the partisan axle here, but, you know, what I heard the chairman say is he's not trying to change the law of the land as it relates to pre-existing conditions. He's not trying to change the law of the land as it relates to keeping your uninsured children on your family's policy. He's celebrating the fact that folks have access to health insurance who had not had access in the past. The only question is, are we getting the best bang for every dollar in doing that? Are the estimates exceeding anyone's expectations? And the answer is no. It doesn't matter whether you're the most partisan Democrat or the most partisan Republican or anywhere on the spectrum. Everyone expected more in terms of insuring the uninsured than the Affordable Care Act has delivered. I think good for the chairman for celebrating the successes, but we all expected more, and candidly, I know we can do more. Mr. Chairman, it is always valuable to me to see you here, because I hear a very persuasive charge so often from my colleagues on the other side, and that is, for Pete's sakes, if you don't like the Affordable Care Act, what are you going to do for it yourself? And that's not just a partisan charge. I hear it from constituents back home. For Pete's sakes, Rob, if the Affordable Care Act is causing so much harm to families, what are you doing to do more? The answer in Georgia, as you know, has always been, have you looked at Dr. Tom Price's bill? Have you looked at what the practitioners would do instead of what the lawyers would do? Would you look at what would happen if patients and doctors worked on this instead of regulators worked on this? That's not a Johnny-come-lately spirit that you have had. That's been a spirit that you've had ever since you came to this body, and I brag on you regularly, and I'm glad to serve on the committee that you both lead. With that, Mr. Chairman, I yield back.
Thank you very much.
HR
Ms.
2300 is the bill.
2300.
Ms. Van Hollen, I acknowledge you've got to go because there's a vote going on also that we are running down to, and I'm going to let the gentlewoman tell me there are about 300 that have not voted. That would seem to indicate that you've got some time, so the gentlewoman is now recognized. Mr. Yarmouth, welcome to the
Thank you,
panel.
Mr. Chairman. Pleasure to be here again.
I'm very glad that Mr. Yarmouth is here. Mr. Yarmouth, you and I both born and bred in old Kentucky, right? And I've been extraordinarily proud of Governor Beshear and what he's been able to do in Kentucky. And I appreciate it if you try to set some things straight here on how this works and what it's doing for people. I remember seeing on 60 Minutes what was happening in Eastern Kentucky with no available health care, an old van driving around trying to check people with black lung disease. Tell me give us what happens in a true case of people getting health care they never had access to before.
Well, I appreciate the opportunity to do that, Congresswoman. In Kentucky, the experience has been nothing short of miraculous. Kentucky was, and to a certain extent still is, one of the most challenged states in terms of health condition. We rank very low in many measurements, but we have been able in just 2 short years to reduce the number of uninsured in Kentucky by more than 50%. I think we lead the country in that statistic. In my district in Louisville, we've reduced the number of the percentage of the uninsured by 81%. There are actually, in my district of 720-something thousand, there are fewer than 20,000 people now without insurance coverage. It's an astounding accomplishment. More importantly than that, when you look at the way people have accessed care on virtually every measurement, whether you're talking about preventive health screenings, cancer screenings, so forth. On every one of those categories, we have triple-digit increases in participation. So people are accessing care, they're getting analysis, they're getting preventive care and screenings and so forth. Governor Beshear, earlier this year, commissioned the Deloitte company to do an analysis of what the impact of the Affordable Health Care Act in Kentucky would be over the period from 2015 extending through 2020, so a 6-year period. And what they concluded was that over that 6-year period, Kentucky would generate 41,000 new jobs because of the Affordable Care Act, additional economic activity of $32 billion, that's billion with a B, and the positive impact on the Kentucky budget would be about $850 million over that period. So in Kentucky, we figured out how to do it. People are getting access to health care, and the economic impact of that on Kentucky has been extremely positive. So to repeal, understand we're not repealing every element of the law, but we're repealing some provisions which essentially negate the law.
Indeed.
If you repeal the individual mandate, and Mr. Woodall talked about the issue of pre-existing conditions and so forth. The only reason that we were able to guarantee people could be insured with pre-existing conditions was because everybody had insurance. That's because of the individual mandate. If you eliminate that, and people then can come into can avoid paying, the healthy people can avoid paying premiums. Right. They'll take a risk, which adds cost in another area, because then we go back to the area where you have uncompensated care if somebody gets injured or has an illness. But basically, then you get the sickest people with insurance. They won't be able to guarantee that they can provide insurance for everybody, regardless of their health history. All of the things that went together as a part of this package would dissolve if you eliminate the individual mandate.
Well, there's no question that every president since Teddy Roosevelt's tried to do this, obviously for very good reasons. The most simplistic one is, and I think doctors all agree with this, is that you give people access to care with insurance. You keep them out of the emergency room, which is the most expensive care available. Is that not true, Dr. Price?
Well, it's expensive care, but there's a much better way to do it than is being done right now.
What's that?
Well, I would suggest it's H.R. 2300, which gets folks covered with coverage that they want, not that the government forces them to buy.
And how are they going to pay for that?
Well, yeah, I'm happy to share the bill with you. We go through tax credits, refundable tax credits, advanceable refundable tax credits, so that every single American, not just the 3 to 4 million that were increased coverage in this, every single American has access to the kind of coverage that they want.
So every single American, whether they work or not, is eligible for tax credit?
Absolutely.
Really?
Absolutely. H.R. 2300. I urge you to take a peek at it. Love you to be a co-sponsor, as a matter of fact.
Let me tell you, we worked awful hard on this bill. It bothers me, it just troubles me so much. And when I hear this was written in the dark of night in a back room somewhere, the Democrat caucus went over this word by word 3 times. We met in here on it when we were doing the rule all day long on a Saturday, getting ready. Every committee that looked at that was a bipartisan committee. There were Republicans and Democrats on it. A lot of Republican amendments were in the bill. And as we said, Senator Grassley made a great imprint on it. And it was very hard. We passed it by 7 votes. Not a single Republican voted for it. And all I've heard since 2010 is got to get rid of that. As it grows and people appreciate it, and what Mr. Yarmouth has just told you is not pie in the sky. You're saving money because you are doing preventive care. And it's absolutely, I do not understand this fetish that the Republican Party has to take health care away from people.
Well, then nobody has any desire to take health care away
no,
from
wait a minute. This Planned
Not a soul.
Parenthood. Planned Parenthood is the very same thing. It is health care that they get. It is health screening that they get, men and women. And you want to kill that? And the community health centers have made it clear. In the first place, they're not all over the country, but they have made it clear that there is no way that they can make up for that population.
That's simply not true.
It
There are
is
13
absolutely true.
times-
They said so, and I'd rather take their word, if that's all right
There
with you.
there are 13 times more community health centers than there are the institutions
No,
to
but
which
they
you
are
refer.
telling you that they cannot cover that population, that they cannot do that.
That's why we
But so
provide more
what
resources
you're
for
going
it.
to end up with, and I will tell you, come out of all this and all this discussion, your 61 votes, it comes down to a very simple thing. You don't want to provide health care.
That's not true.
It is true.
No, it
You
it
are
simply is
taking
not.
healthcare
I
away
know
from
you want to
people for
say
no-
it, but it's not
You
true.
know, as Mr. Van Hollen pointed out, Chairman Chavez said they hadn't broken any law. And you've got 3 committees right now, have you not, examining Planned Parenthood. And you're going to do one of your great select committees over there that spends millions of dollars, goes on for months and months and months and comes up with nothing. So that would be 4 committees on that, even though the first chairman looked at it, said they haven't broken any law. So you're going to waste all that time and all that carrying on, and you're going to come up with nothing, right? I watched the grilling of Cecile Richards, 5 hours, which was painful to me. And if you think that the women in this country and everybody isn't noticing, I think you're mistaken. There may be parts of the country where they don't want it, but why in the world you would punish everybody?
That's why we're increasing resources for women's health.
You're not.
But
And
no,
you know
that's what the
something?
bill
I just
does.
can't let you get away with that.
That's what
You're
the bill
not
does.
increasing resources
Read
for
the
yourself.
bill.
If nobody, you can say that you're going to give it to community centers. If the community centers say we can't do it, what have you done?
Simply-
You have taken away from them the health care that was there, that they've been using for 100 years. And to replace it with something by an organizations who tell you they can't do it.
It's a 1-year moratorium, and it provides increased resources for community health centers and women's health across this country. So
Why don't you wait till your 3 committees get through and your great special committee over there and decide what to do about Planned Parenthood? I mean, you made the decision already. I read that very thing in here that you feel perfectly satisfied now that you should go ahead and defund it. And so what about all the money and time being wasted? In this place, as I pointed out a while ago, we got no budget, got no speaker, got no highway bill, got no education bill, taking away Perkins loans from the poor students, all this mishmash going on here. And then on top of that, you want to take health care away. People who've never had access to it before. Mr. Yarborough can tell you, and if I'll hush you, I'll let him do it. Mr. Yarborough, tell us what it's like in eastern Kentucky and what it's like to find a doctor and get to some help.
Tell them about the co-ops that are closing in
you.
Kentucky.
It's very
Why don't you tell them about the
And tell
co-ops
them
that are
if
Well,
we
the
closing?
can
co-
create
the co-op-
incentives to
If the
do it.
gentleman yield just one
Sure,
place,
yes.
gentleman yield.
I'd be happy to.
We have a whole lot of fun up here, and what I'd like to
I'm not
say,
enjoying
I've experienced
that
it
much.
before.
you don't have to enjoy it, Luis, you're having,
Okay.
here's the bottom line. We're going to take a recess, and then we're going to finish our votes downstairs, and then we're going to come back here, and Mrs. Slaughter will have the time.
Before we go, though, I
All
want to say
right.
one thing.
Yes,
It is
ma'am.
absolutely pathetic that the House of Representatives of the United States Congress can't do its business and consistently brings up these peripheral ideas that you know aren't going anywhere. And we come up here as part of the charade and sit here and play like we're serious about this. I wish you guys would really get serious. Find yourself a speaker and let's do something.
Yeah,
and try to
well,
work together.
we've got a
Get the
speaker.
country moving
We got a
again.
speaker,
Thank
but
you.
I'd like to advise the gentlewoman, did you yield back your time?
No, I want to continue when I get.
Gentlewoman will yield back her time we get back. I advise most of our witnesses that when we finish the last vote, if they come back up here, we'll then proceed accordingly. So subject to the end of the votes and the call to chair. Committee will come to order, and we'll pick up where we left off. I see Father Conroy is no longer with us. I will not use the word departed. I will say he's not here, but Father Conroy was here to try and wish us the best, and the gentleman's recognized.
Thank you very much. And I just want to continue what I said a while ago about this colossal waste of tax money and time producing absolutely nothing for the people of this country that sent us here should be something that we would consider with shame. And I'd like to ask unanimous consent to put the statement of the administrative policy about this bill and say to that, obviously, the president would veto this bill, but we knew that before we started. I ask unanimous.
Without
consent to
objection.
Put it in the record. Thank you. I yield back.
Gentlewoman yields back her time. The gentleman from Oklahoma.
Thank you, Mr. Chairman.
Yes, sir.
I have no questions. Yield back.
Thank you very much. The gentleman from Massachusetts.
Well, I just want to associate myself with the remarks of the ranking member here, and just kind of point out for the record that, just so no one has any question about this, that somehow this is all on the level. We know what's going to happen. You'll pass this through the House because you can ram anything through this House. You get the votes, and I don't know what the Senate will do, but if it makes it to the president's desk, he'll veto it, and that's the end of that. And I think our time would be better spent dealing with the debt ceiling and trying to keep the government open. And if my friends have good ideas on health care reform, then you're in charge. You should bring anything you want to the floor. But let's not fool ourselves into believing that this is going anywhere. And we're just, I think it's a waste of our time when there are other pressing things we ought to do. So with that, I yield back, Mr. Chairman.
Thank you very much. The gentleman from the the Energy and Commerce Committee, who is also doubles as an expert witness here at Rules Committee, gentleman, Dr. Burgess, recognized.
Thank you, Mr. Chairman. I want to talk for just a minute about a woman who's losing her health insurance because she came in to see me a week ago. Her name is Cheryl. She's from Frisco, Texas. She is in her early 60s. Her husband is about 10 years older than she is, so he's covered under Medicare. And in 2007, she bought a policy, an individual policy on the individual market and had health insurance coverage. The premiums were manageable, and she continued with that for several years until the Affordable Care Act. The reason she was in to see me, her current premium, her current insurance coverage for this calendar year 2015, the premium is $660 a month for just her. She's got a $6,000 deductible. She has the same insurance I do, a bronze plan in Blue Cross. She's concerned because Blue Cross is no longer going to sell PPO insurance in the North Texas market because they were losing too much money, even at a $660 a month premium with a $6,000 deductible. She takes several medicines. Obviously, these she has to pay the out-of-pocket cost because they're not covered with that high a deductible. And her question to me is, I don't know what I'm going to do. November 1st, there will be a new premium schedule revealed, and I doubt that it's going down. And I'm maxed out with what I can afford right now. She recognizes that if she doesn't maintain coverage, that she will receive what's called a shared responsibility charge on her income tax. So that concerns her. That's the individual mandate. And her question to me is, why don't you fix this? Why don't you do something about it? Here's the problem. Congress doing something about it is what caused her to lose a policy that was quite affordable, did not cover everything under the sun. I'll grant you that, but it covered what she needed covered. And should she be so unfortunate to get leukemia or be in a motorcycle accident or develop a brain tumor, she would have had that major medical coverage through that policy she had in the individual market. Now she finds herself priced out, and her question to me was quite simply, what am I going to do? I cannot afford what you have done to me. So there's a woman who's losing her health insurance. I would very much like to roll the clock back for her. I don't know that if it's ever really possible to do that, but one of the reasons I am so supportive of the reconciliation effort that is going on right now is I do feel that we do need to make policies available to people that they can indeed afford. Now, the chairman asked a question about whether people in the administration would take or should take coverage under the Affordable Care Act, if they should take the same types of policies. It was, I thought, instructive and telling when Secretary Sebelius was Secretary of the Department of Health and Human Services, and she came and testified in our committee, and you may remember this, Mr. Yarmouth. She was asked directly, will you give up your coverage under the Federal Employee Health Benefits Plan and be covered under the exchange? And I think her answer was, if I recall correctly, don't make me do this. She was clearly uncomfortable with having to address the fact that she was not going to go into the president's health care plan. Thank you very much. She would stay with the Federal Employee Health Benefits Plan, as do most people who work in the federal agencies. And this was a failing on your part when you passed the Affordable Care Act. Yes, members of Congress and their staff have to be covered under some aspect of the Affordable Care Act, but really the political appointees in the federal agencies likewise should have been covered under the Affordable Care Act, because everyone should understand just the problem that Cheryl brought into me last week when she discussed her coverage. Now, Dr. Price, we are getting some, well, let me just make this observation. There is one of the Democratic candidates, I'm not sure how many of them, but I know at least one she was quoted in Politico just a few weeks ago as saying, we need to kill the Cadillac tax. So you're helping candidate former Secretary Clinton, aren't you not, by doing what she's asking for, killing the Cadillac tax?
Well, even a blind squirrel finds an acorn every now and again.
Well, I would think that then this would be warmly embraced, because the Cadillac tax, yes, certainly it affects people who work in, who've received their health care benefits through competitive bargaining or collective bargaining with labor unions. But even employees that, I mean, we're not in the individual market any longer, but talking about people in the large group market, in the employer market, some of those policies, I've talked to people in some of the big telecommunications companies in North Texas, and they are worried as can be about this 40% excise tax that is going to be on benefits that are in excess of $10,400 for an individual.
No, you're absolutely right, and I'm moved by the story of Cheryl, because this isn't just about numbers on a paper. This is about real lives, and real lives are being harmed by this piece of legislation and the law that was enacted. And as a physician, and a fellow physician with you, Dr. Burgess, we talked to our former colleagues. We know what's happening. The patients are denying themselves care. Cheryl has $12,000 that she's got to go through before she can get any coverage.
A nickel of
any
coverage.
a nickel of coverage. $12,000. When you throw that on individuals who are making $30,000, $40,000, $50,000 a year, which is seen by many as a significant amount, they don't have any coverage. They've got a health plan, but they've got no health care, so this is real stuff, and that's why it's so important that we move forward with a piece of legislation that would allow individuals to purchase the kind of coverage that they want, not that the government forces them to have.
Well, let me ask you this, because Chairman Sessions went through with you what this reconciliation bill will do, about what it would remove if it were enacted. Now, there's some criticism that comes from presidential candidates on the Republican side that, hey, it doesn't do enough, that we're leaving some stuff on the table. So if I understand correctly, and you had this discussion with the chairman, some of the things that are left on the table, coverage for children up to age 26, a lot of the rules that were passed at the agency level, like the chairman referenced the ACOs, and the ACO rule was passed at the agency level. All of that, let's assume for a moment that the reconciliation bill passes, the president gets a flash of insight and signs it into law. Republican president is sworn in January 2017. There are things that the executive can do that day that undo the parts of the Affordable Care Act that are still left standing. So to repeal rules passed by federal agencies, the president can issue instructions to the agencies to begin to move in a different direction. Is that not correct?
That's correct. And this is an important point because that could indeed happen with a president who was responding to the needs and the wishes and the desires of the American people, but it can't happen through reconciliation. Reconciliation bills have very narrow rules, and they have to deal with either spending or revenue in this instance. And most of the rules that you would refer to and others would refer to in the bureaucracy that have been promulgated don't have necessarily to do with spending or revenue. And if we were to include those in this piece of legislation, then it would lose its privilege in the Senate to be to proceed through an expedited manner to the Senate floor and be able to get to the president's desk.
The only point I'm trying to make is those who are critical, because this doesn't repeal every syllable of Obamacare. There are going to be other opportunities if they do their job and win the election and are sworn in. The agency rules that have been promulgated under President Obama can be undone in a Republican administration. And furthermore, and we've had a lot of discussion up here, the president seems to enforce parts of this law that he likes and holds off on other parts that are inconvenient or embarrassing. Another president could do exactly the same thing. I hope we do pass this. I hope we do repeal the individual mandate, because I think that's one of the most pernicious aspects of the Affordable Care Act. It's that coercion of forcing people to do something, assigning them a shared responsibility payment on their income tax form because they didn't do what the government said they were supposed to do. That just makes no sense in a free society. But beyond that, with what's available to a new executive of the remainder of the Affordable Care Act, I think the stage will be set by passing your legislation. The stage will be set then in a year's time for another executive to begin to undo other parts of this. And if they really do behave like the current executive, they can just ignore the parts that are no longer pleasing to them. So I think, Mr. Chairman, this is a good piece of legislation. Now, one other thing. Now, you all started to talk about. Well, hold on just a minute. Let me finish this thought, because it almost escaped me.
I was hoping
the co-ops, that has been part of this story that really hasn't worked out as well as the administration would have liked. So co-ops in your state, Mr. Yarmouth, are they doing okay?
No, actually, the co-op in our state announced that it was closing at the end of this year. The co-op, the initial year of its operation, 2014, lost about $60 million. That loss dropped to about $4.5 million last year. But then Congress decided in its infinite wisdom to slash the fund that was designed to actually help the co-ops make it through the first few years, because it was understood that they'd probably get adverse selection. They were going to end up with the sickest population, which was certainly the case in Kentucky. And so the funding that was available to support them through that second year was not available. They closed down. The good news in Kentucky is, instead of 3 insurance companies offering policies in the state now, next year they're going to be 7. So there will be adequate competition, which means that there'll be probably the same impact of having that co-op in the market.
Good news for you in Kentucky. My bronze plan in the Blue Cross Blue Shield PPO is going away in Texas, so I'll have one less. Yes.
$146 million, taxpayer dollars, given to Kentucky to run the co-op. 51,000 people will be out of health coverage at the end of this year because of what Kentucky has done. This is the pernicious aspect of this bill.
Well, they won't be out of coverage. They'll just find another provider.
So as a business plan, if you're losing money, you can't make it up in volume. I'll be happy to yield to the gentleman from Massachusetts.
I was just going to say, when your candidate Donald Trump wins, we'll have a single-payer system in this country. So we could all look forward to that. So I don't know if he could do that through executive order, but I'll support him if that's what he's going to do. Yeah. So anyway, I yield back.
Just for clarification, my candidate is my senator from Texas, and I look forward to his being able to finish the good work that Dr. Price and the various committees have started. Mr. Chairman, I'll yield back.
Gentleman yields back his time. Thank you very much. The gentleman from Ohio, the gentleman, Mr. Stivers, is recognized.
Thank you, Mr. Chairman. I appreciate this hearing. Thank you both for being here. Appreciate your hard work. I know you don't quite agree. I wanted to take off on a couple things that the gentleman from Texas just talked about, Mr. Chairman. So there are about 10 or 15 labor unions who have endorsed doing away with the Cadillac tax. They should be pretty happy. This does away with the Cadillac tax.
I think that there are many things in this bill that the American people in a broad spectrum, bipartisan spectrum, will be pleased about.
And, you know, there's a lot of taxes, a lot of big government that is eliminated in this bill. It doesn't get rid of everything that some of us hear, and we've got a lot of work to do. But certainly, I think this is an important thing to try to do what we can, and I appreciate your hard work on it. I think it's a good bill, and it's a good package. It's not perfect. It doesn't have everything. It might have some things some people don't like. It might not include some things that some people want for reasons of parliamentary rules or whatever. But I think it's a good package, and I want to thank you for crafting it, Mr. Chairman. Thank you. I yield back the balance of my time.
Thank you very much. Gentleman yields back his time. The gentleman from Alabama, do you seek time?
Yes, sir, very briefly.
Gentleman's recognized.
I wanted to address the question about what this law has done to coverage in the state of Alabama. Mr. Van Hollen, I'm from L.A., Lower Alabama. This law is going to require, and people from Blue Cross Blue Shield Alabama told me this personally, that they have been instructed by the government to increase their rates on the exchange, and they're the major provider on our exchange, to increase their rates to by 28%. That's a dramatic increase in premiums. So there are a number of people calling my office in my district saying, I can't afford my premiums. And even when we try to help them with premium support, it's not enough money in the premium support, so they're dropping their insurance. Second way it's hurting my people, and we've talked about this already, is the deductibles. Lots of people calling me about deductible problems. I mean, hundreds have called us about deductible problems. Because, as you said, Dr. Price, they can't afford those deductibles. It's just not, for a middle-class person, it's not there. But here's the third one. Here's the big one. I have a bunch of rural hospitals in my district. They're not big, they're small, but they're near where people live, and you have a lot of older, very ill people in those areas. And the effect of this law on those rural hospitals is devastating. We're projected to lose a number of rural hospitals in Alabama this year. And the Alabama Hospital Association has told me it's because of this law. So this law is going to deny health care to a lot of people in my district, already is denying health care to a lot of people in my district. It's unfortunate. I don't think it was intended. In fact, I believe very strongly it wasn't intended. But when you pass something this big that affects that big a part of the American economy, and there are just going to be unintended consequences. And what we've learned is unintended consequences are so far-reaching that people on both sides of the aisles want major changes. This bill does not repeal Obamacare. I had the bill this year that we did pass through the House that repealed Obamacare. It's dead in the Senate. This bill doesn't do that. But it does change a lot of important things that could benefit the people of my district, people throughout the United States of America. And I think it's important. I think it's our role to try to respond to the needs of our constituents. And I think this bill is going somewhere. It's going from here to the Senate, and it's going to go from the Senate to the President of the United States. Now, the President may veto it. I can't control that. The President sends lots of things over here that we could very clearly say, it's not going anywhere, but he sends them anyway. And that's our system. And so we're following the system. We're listening to our constituents. We're voting our conscience. We're voting what's in the best interest of our constituents. And we're trying to make dramatic changes to something that may be giving a few people, relatively speaking, a few people coverage, but denying health care to a far, far greater group of people. So that's why I vote for this rule and vote for this bill with a clear, clear conscience. I do appreciate both of you being here, and I appreciate
Mr. Berman, may I just make one comment in response? I don't know whether or not it's true that the federal government instructed Blue Cross Blue Shield of Alabama to raise its premiums by 28%. I've never heard anything like that.
Me either.
I don't question. I mean, you may have the right information, you may not. All I know is, and this I've seen it time and time again, it's happened in my jurisdiction as well as others, that providers continually blame everything they do on the Affordable Care Act when in fact it's not always, it's something they want to do, and they say, oh, the Affordable Care Act made me do it. We've dealt with it with hospitals, we've dealt with it with insurance companies. Under the law, in order to get more than a 10% premium increase, you have to justify it to the state insurance commissioner. So I would say that they have an obligation to do that, and your insurance commissioner would have an obligation to review those rates to see if the rate increases, to see if they're justified.
And I haven't talked to our insurance commissioner, but I do know the people at Blue Cross and Blue Shield in Alabama. They're a major player. I mean, we all deal with them a
They were
lot.
the only insurance company, basically.
Well, they're
in
pretty close to
Alabama.
it,
Yeah.
pretty close to it. So we deal with them a lot. They're well-known. They're a pretty professional group. Their stuff is out there, and we know their numbers. Everybody knows their numbers. A lot of the doctors don't care too much for them because they're pretty hard on them about what they reimburse for. But I don't think they're trying to play some game with us here. They were actually hoping for the lower level of coverage to have a much less increase because they knew that's where it was going to pinch the most. They were trying to push their rate increases up to the higher levels. And the government says, no, you can't do that. It's got to be the same for all three levels. So they were instructed, and I'm telling you what they told me, they were instructed by the federal government to charge 28% increase to everybody. And I know from the phone calls we get to my office that I'm getting more and more people that simply won't be able to afford those premiums and they'll lose their health insurance. So we can talk about this, but we know that there are major problems with this law. I'm not going to try to put any of my colleagues on the other side of the aisle on the spot, but I've talked to lots of my colleagues on the other side of the aisle who are hearing the same things I am, because this is not just for lower Alabama. I don't know what the president's going to do. He probably is going to veto it. But you know what? We better sure start talking about how we're going to fix these bigger problems. Because at the end of the day, the people of America, they're just not going to stand for it, and they're about ready to do something a lot bigger than what we're talking about here today. So I don't know what the ultimate solution is going to be. I've always been willing to be a part of a solution. I promise you that. But so far, I haven't really heard any solution come from the White House at all, except a pretension that this is working when it's not working. It's just not working.
I think the Democratic caucus in this House would welcome the opportunity to review suggested changes to the law on an individual basis and make improvements in the law. I think we've always held that was our position. It's difficult when you know that you're going to get a repeal amendment to anything we try to do. It's going to be a repeal.
Well,
So I think I would look forward to working on that.
I would end with this.
Cadillac tax being included.
But I think the American people are pretty forgiving. If you say, look, we made a mistake. We had the best of intentions. We poured ourselves into this, but we made a mistake. Let's go back and admit we made a mistake. Repeal the bill and put something else in that we agree on. I think the American people would say, hooray. They admitted a mistake, and they worked together and put something else in that does make sense. Now, I think that's something we ought to all be able to work on. I'm more than happy to work with anybody to make that happen, because I don't want to have to answer any more phone calls, talk to any more people, women that come up to me with tears in their eyes because they're losing their health insurance or they can't pay for a procedure that they need to have with their doctor. I want to get something to work for the people in my district. That's all I want. And I think that's really all that any of us want. And I thank you, Mr. Chairman. I yield back.
Gentleman yields back his time. Thank you very much. Does the gentleman does not seek time. I want to thank both of you for taking time to be here today. The debate continues. Mr. Chairman, Chairman Price, I want to say that we did recognize in January or February when you were here first and you talked about presenting the bill and you came up with your budget. You spoke about reconciliation as a process that would be available if and when you would get together and determine that with the Senate. And I want to thank you from my perspective. You have done not only a fair and admirable job, but you've been the leader in the process. I want to thank you for your time and your conscience of getting this done, and I think you've done a job for this conference.
Appreciate the opportunity.
I very
to be
much
on tonight.
appreciate.
Thank you.
I want to thank both of you for being here today, and thank you very much. We'll now move to the second panel. Before we do that, I want to acknowledge several of my friends that are here. The gentleman from Iowa, Jeff Goodman. Mr. Goodman, thank you for taking time. I know you're visiting your favorite senator today, Senator Grassley. Mr. Barker, thank you very much for taking time to come up to the Rules Committee today. And of course, as always, David Cole, Mr. Texas Tech University, who's an intern in my office. I want to thank you for being here also. The committee now will be available to any witness, and I see the gentlewoman from Wyoming, the gentlewoman Cynthia Lummis. Ms. Lummis, if you'll please feel free to take the, not only sit through the several hours of discussion that we've had, but that you're making yourself available. I just love it. There's been a lot of discussion across, not just my conference, but I think across Congress about the importance of showing up at the Rules Committee to ask that your amendment be made in order. And it makes it so much easier when you come and do that and present your own amendment. So without objection, anything you have in writing will be into the record, and we want to thank you, and Joan Williams recognized.
Thank you, Mr. Chairman. I want to thank all the members of the Rules Committee for your service on this committee. It is a arduous task involving hours and hours of your time. It is gratefully appreciated by those of us who do not have to spend those arduous hours. I am proposing an amendment to the budget reconciliation proposal. What I'm proposing is a replacement amendment that includes the text of Representative Bradley Burns' H.R. 596. It passed the House by a vote of 239 to 186. Also included, in addition to that bill, which essentially does include a full repeal of the Affordable Care Act, is using sections 202 and 203 of the base reconciliation bill that was produced by the Energy and Commerce Committee to defund Planned Parenthood for a year and transfer the funds to the community health centers. With regard to my reasoning for proposing the full repeal of the Affordable Care Act, a determination is made at some point by the Senate parliamentarian as to what qualifies under reconciliation. And I really appreciate the efforts of our Budget Committee Chairman to attempt to deal with some of the comments we've heard. I have not met with the Senate parliamentarian. Quite frankly, it's not, I believe, my place to go meet with the Senate parliamentarian. It is the Senate's place to work through the process of determining within their own body what components of the Affordable Care Act can be repealed and still comply with the Senate parliamentary rules relating to reconciliation. So I have not attempted to parse the Affordable Care Act. In this amendment, it is a full repeal of the Affordable Care Act. It is accompanied by the recommendation that Planned Parenthood be defunded for a year. I'm on the committee, the Oversight and Government Reform Committee, that did the hearing on Planned Parenthood. We learned that there are over 900 people that are aborted every day of the year by Planned Parenthood. 900 people. That is 327,000 abortions, and that's a staggering number. It is legal. That is not the point. The point is Planned Parenthood is provided with taxpayer dollars, dollars that come from people who find those practices to be just reprehensible and outside of their morality. And it has been correctly pointed out that it is not the federal dollars that are being used to abort these 900 people every day. It is private funds. The private funds' ability of Planned Parenthood to either raise money through their services or to acquire money through charity is really quite extraordinary. Their fundraising capabilities are impressive. In other words, they can continue to perform the services they perform without federal dollars because of their impressive abilities to raise money from other sources. So I want to support the efforts of this reconciliation bill just to say, let's give the money that is currently being used by an organization that is performing activities that so many Americans find so morally reprehensible, and give it to community health centers where the full array of women's health care can be provided. This will not interfere one iota with Planned Parenthood's ability to provide birth control pills and advice to prevent pregnancy, which I fully support. I'm glad that Planned Parenthood is there to prevent pregnancy. But 900 people day in and day out, every single day, being aborted and providing that money as a taxpayer, I just find that morally reprehensible and indefensible. So I applaud that component of the bill. And I do want the committee to have an opportunity to see a proposal that represents a full repeal of the Affordable Care Act. Again, Mr. Chairman, thank you. Your valuable work is deeply appreciated by us. I yield back.
Thank you very much. Ms. Lummis, as I recall, you're a lawyer. You have been trained in the art of not only reading and thinking and doing things that are related to the law. And I have always known that you expect precise answers, and I have seen you at the Rules Committee talk about those things. And I want you to know that we're quite honestly delighted that you have come up here with your amendment. I will offer some bit of feedback that our committee might do as we move through this, but that is that this ability for reconciliation has been thought, talked, studied, kicked about, and scrubbed numerous times in an effort to make sure that we do not stumble as we prepare not only in the processes here at the Rules Committee, but also in as much as that we looked at everything in the House that our performance would be necessary for reconciliation. It is our belief in working with our colleagues in the Senate through discussions, I don't know, I have not attended them, but presumptively about the parliamentarian in the Senate, and a determination was provided on a professional content basis to not only Mr. Price, but also in a, it's my understanding, in a meeting that took place, but also to our committee chairman that would be relevant, that the trigger for them, if it went with whatever we passed when it came to the Senate, the trigger would be, does it trigger reconciliation or does it trigger a privilege to the Senate that would require 60 votes for them to agree to discuss this? And I just want to say back to you, and I know you very methodically went through your process of your hopes and desires. Is there anything about what we're doing with Mr. Price's bill that you think would trigger a 60-vote privilege to the Senate to take that in? Anything at all in his bill?
Mr. Chairman, the vagaries of the Senate Parliamentary Procedures and Rules give me pause. I know of nothing in either the Budget Committee's proposal or the proposal before you in the form of, in the nature of a substitute, that is a guarantee of Senate parliamentary concurrence, nor have I spent, admittedly, the time that Mr. Price and his committee have trying to understand the best way to posture a House bill for consideration by the Senate. I readily admit that the chairman of the Budget Committee has spent more time preparing his proposal than I. I bring it to you because there are colleagues in the Senate who have come to me and said, we believe that the full repeal would be found suitably acceptable to the Senate parliamentarian and encourage you to propose that, hence this proposed language. So this actually does come with Senate encouragement, albeit not the chairmen of the committees of jurisdiction.
Okay, one last question, I think, because this committee, as I see you outside of the committee, as you see our members, we're most appreciative with you taking 3 hours out of your day to be here. And we know that you recognize you being here is important, and we do too. If you were aware that we believe an example of the things that could be in the Obamacare bill included a repeal of IPAB because it was done and from a function of when it passed in the Senate under their different piece parts that they put together, that this would trigger a 60 vote requirement under the privileges of the Senate. Would you still pursue this matter, your bill, even if you knew that it would violate the terms, could violate the terms of reconciliation and put the threshold on the Senate to overcome that 60 votes?
Mr. Chairman, no, I would not.
You would not. Thank you. That's a straight answer, and I hope it was a very fair question. Please don't turn that green light off yet, because you've got lots of other people that want to engage you. I want to thank you very much, not only for your charm and graciousness, but for your hard work and opening up yourself to members of the Senate who would feel comfortable in speaking with you about carrying these important issues. Thank you. Chairman Cole?
Thank you, and I want to thank my friend for being here and tell her how much I agree with what she's trying to do. I think she's trying to get at the core of an issue that disturbs many of us across the board, and I think she's trying to give the president a hard choice. Unfortunately, I don't think it's a hard choice for the president, and so I am worried that we might trigger some of these things. Although, again, I understand there is a difference of opinion on this, so I think it's worth thinking through and making sure we're right. I suppose I probably disagree with a lot of members in that it seems to me you can use reconciliation to make a point or to force a choice. I think, and frankly, not just in your effort, but I think in the effort we're embarked on. So this is not in the least critical of what you're trying to do. Actually, if we could achieve what you're trying to do, I'd be ecstatic. But I don't think that's likely. And so I've always wanted to give the president a hard choice, something that he has said he's for in the past, that we know the Senate wouldn't allow him to actually vote on, and then putting more. So I just say this just to state my position, not to challenge anybody else's. I've always wanted to take something like, a couple of years ago, he said he was for change CPI. He said he was for means testing for Medicare. I'd like to have him make that choice. I'd like to put that right on his desk and see if he's remotely serious about dealing with the fiscal problem we have. Now, I don't know what he would choose to do. I would actually hope he embraced his previous positions. But at least we would give him a dilemma. You know, I think the things we're pursuing here, both in the main motion and your amendment, are things I agree with. And yeah, I think, frankly, no doubt the Budget Committee Chairman, who we both admire and respect and have the privilege of serving on his committee, would be as robust as you are in your amendment if he thought procedurally it could make it. He really would. He would be right with you. The members of that committee would be right with you. I think the same thing's probably true on the Senate side. I don't begrudge anybody their opinion, but I end up respecting the opinion of the chairman over there as well, because they're probably better advised. But again, that to me is to almost, again, I'm not going to be critical of my friend for pursuing an objective that I think she's right to pursue and that I think is the right policy. I guess just tactically, I would rather, and I did not prevail in this point of view, I'd rather give the president a tough choice. Look, with all due respect to all my friends, I don't think we're ever likely to get Obamacare repealed while a guy named Obama is president of the United States. It seems axiomatic to me that that's not there. And if the aim is to make a political point, and I'm certainly not against that, sometimes you do that. You make rhetorical points to highlight issues. But in this case, Mr. President's never going to be on the ballot again. We know what the answer. I would rather give him a real choice. Now, I'm not confident at all he would do what I think the right thing is, and that is to embrace his previous positions. But, you know, but again, this to me is an important exercise because I do think it's a clarifying exercise. You know, and that's, I'm not critical of anybody on this. I'm just expressing my point of view. But I want to applaud my friend's consistency in this because she's been tireless and I think accurate in her efforts here. I think we agree on the goal, and nobody would be happier than me if what you propose here could actually be achieved or you know, maybe even placed on the president's desk. Although again, I'd like to make him think about the issue instead of be able to reflexively say, look, I'm not going to do that, boom, that's an easy veto for me. But again, that's just my opinion. So I want to thank my friend for being here. I want to thank her for her tireless efforts. And I want to join the chairman in his remarks and appreciation for what you do and every day and what you've done here. These issues aren't going away. And I think they'll still be with us on the other side of this presidency as well. And so there's something to be said for keeping them alive, if you will, keeping them teed up, making people make choices every day. But, you know, for me, I'd rather make him make a choice that he has to at least think about. So, but I thank my friend for being here, always interested in what she has to say, and look forward to thinking long and hard as to whether this is the best way or what Chairman Price and his colleague in the Senate are proposing. It's worth thinking about. So thank my friend for bringing it here.
I thank the gentleman and appreciate your perspective very much.
Thank you very much. I appreciate the gentleman. Gentleman yields back his time. Mrs. Slaughter.
Thank you, Mr. Chairman.
Yes, ma'am.
I don't have any questions, Ms. Loomis. It's always nice to have you here. I have been asked by Mr. Hastings if I would ask unanimous consent to put his remarks supporting his amendment to HR. I'm sorry? Mr. Conyers, I beg your pardon. This is Mr. Conyers' amendment. He couldn't make it here to the meeting tonight. Mr. Conyers says that since we only have one shot at reconciliation to improve the lives of American citizens, we should do something different in his view. And specifically, he is here to speak, or would be, in support of the amendment to H.R. 3762, which would use the budget reconciliation measure before us to cancel the sequester. And I ask unanimous consent to put it in.
Thank you very much. Without objection, we'll enter that in the record. I do know that Mr. Conyers indicated he felt like he would be here, but in fairness to Mr. Conyers, this process has taken a long time, and I respect that very much.
All right, thank you.
Mr. McGovern, do you seek time?
Just to say that I think we've spent an awful lot of time on something that's not going anywhere. So as far as I'm concerned, if you want to offer your amendment, fine. This is not going to see the light of day. It's going to be vetoed by the president if it gets to his desk. And so I would prefer that we spent hours talking about something that we really need to do, which is deal with the debt ceiling and keep the government running, or maybe even do a highway bill or something that might actually help the people of this country. But if people want to score points with the right wing by repealing the entire health care bill or another attempt to go after Planned Parenthood, you can do whatever you want to do. But to try to portray what we're doing here is somehow serious and on the level, I think is a stretch. And so appreciate you being here, but I think we've wasted enough time up here. I yield back my time.
Thank you very much. Gentleman yields back his time. Boy, you're getting a lot of good points here, Ms. Lummis. This is good. You're a very popular witness. Can't leave yet. Got to stick around. You got Murderers Row ahead of you. The gentleman from Georgia is recognized.
Thank you, Mr. Chairman. Ms. Lummis is one of my favorite members in this institution, and largely because of things like this. Here we are trying to figure out what's doable. And Ms. Lummis is up here talking about what a whole state of folks back home want her to do. They're not interested in what's doable. They're interested in folks doing it. I hate to see what you are proposing dismissed as some sort of partisan chicanery. It's what I hear about when I go back home, too. I have gone through some of the Senate parliamentary issues. We have worked through it on the Budget Committee, and I do not think that the Senate looks fondly on what you are proposing from a parliamentary standpoint, but from a policy standpoint, for Pete's sakes, it's what we all said we wanted to do. It's what we all came here to do, and so many folks have given up on actually getting it done, and it just means a great deal, not just to your constituents back home, but to everybody's constituents, that when sometimes we get a little myopic here, focused on the details of the day, there's that bigger picture just called the right thing to do, and that's what you brought before us today. I'm grateful to you for that. Mr. Chairman, I yield back.
Thank you very much. Boy, I'd stick around here a while. You're hearing some really nice things. The gentleman from Louisville, Texas, Dr. Burgess, does not take time. The gentleman from Alabama, you seek time? The gentleman from Washington. Ms. Lummis, I want to thank you. I want to thank you for taking time, not only for your participation, for your time, but also for having a strong belief that we would take the time to listen, try and work through this important issue. It's important that the American people, and in particular people who sent you up here and who sent us up here, know that we're trying to articulate and get the very best that we feel like we can get. And I think Chairman Cole said it best. We really, because of the nature of reconciliation, we really would like to do the very best we can do to put this on the president's desk, to really let him earn his paycheck for the day. And we think that's a good thing. I want to thank you for being here, and the gentlewoman is appreciated, and thank you very much.
Thank you,
If you'll please make sure that we have two awesome stenographers here, that anything she has in writing will be left for the stenographers. Thank you very much. This now ends the hearing portion of H.R. 3762, Restoring America's Healthcare Freedom Reconciliation Act of 2015. And the chairman will now be in receipt of a motion from the gentlewoman from Grandfather Community, North Carolina, the vice chairman of the committee, Mrs. Fox.
Thank you, Mr. Chairman. I move the committee grant H.R. 3762, the Restoring Americans Healthcare Freedom Reconciliation Act of 2015, a closed rule. The rule provides 2 hours of debate equally divided and controlled by the chair and ranking minority member of the Committee on the Budget or their respective designees. The rule waives all points of order against consideration of the bill. The rule provides that the amendment printed in the Rules Committee report shall be considered as adopted, and the bill as amended shall be considered as read. The rule waives all points of order against provisions in the bill as amended. The rule provides one motion to recommit with or without instructions. Section 2 of the rule waives Clause 6A of Rule 13, requiring a 2/3 vote to consider a rule on the same day it is reported from the Rules Committee against any resolution reported from the Rules Committee through the legislative day of October 23, 2015. Finally, Section 3 of the rule provides that it shall be in order at any time on the legislative day of October 22, 2015, or October 23, 2015, for the Speaker to entertain motions that the House suspend the rules and that the Speaker or his designee shall consult with the minority leader or her designee on the designation of any matter for consideration pursuant to this section.
You've now heard the motion from the gentlewoman from North Carolina. The committee is now prepared for discussion or amendment, and the gentlewoman from New York is recognized.
Thank you, Mr. Chairman. I wanted to ask about Section 7. That is martial law, which, well, I've been hearing rumors that we might meet on Friday on a debt limit bill. Is that your understanding?
Let me say this. The gentlewoman's asking a good question. We are attempting to work through, including working with the White House on a piece of legislation that the President, the Senate, and that the House of Representatives could adequately pass, which would ensure that the government does not shut down, and that provisions therein, besides not related to, and related to that position anybody takes, would be ready possibly on Friday. So the thinking is if it would come up at 10 o'clock tonight, I would call a meeting quickly to do that. I believe Mr. McGovern outlined the need and the desire of the minority, of the majority of the American people to quickly understand and address this issue. So we're trying to think ahead. That answer is, if that's what happens, yes, ma'am, that's what we're after.
You know, you know, that's helpful information. I thought martial law was one of those new reforms from the Freedom Caucus.
Well, you know, the martial law has been around for a long time, and it's really, we're really trying to move a piece of legislation, and we have rules, you have rules, we all have rules, but it's to say, we got to get this thing done, and if a decision is forthright that we can avoid further embarrassment by the American people and get our work done, then we're for it.
I have an amendment.
Yes, ma'am.
Mr. Chairman, I move the committee make an order and give the necessary waivers for the amendment to H.R. 3762 by Representative Van Hollen, the ranking member on the Budget Committee, which would call for bipartisan House-Senate negotiations to raise the Budget Control Act spending caps, avoid a government shutdown, eliminate the sequester for non-defense discretionary programs, and provide sequester relief for defense programs as well. And that does address pretty much what you were hoping to do. Maybe we could do some of that tomorrow with this amendment. I recommend a yes vote and request my colleagues to consider that.
Yes, ma'am. Thank you very much for the thoughtful amendment. Is there discussion? Hearing none, we'll now vote on the Slaughter Amendment. Those in favor of Slaughter Amendment, please signify by saying aye.
Aye.
And those opposed, no. No.
Roll call, please.
This amendment is not passed, so we'll go to a roll call.
Ms. Fox?
No.
Ms. Fox? No. Mr. Cole? Mr. Cole, no. Mr. Woodall? Mr. Woodall, no. Mr. Burgess? Mr. Burgess, no. Mr. Stivers? Mr. Stivers, no. Mr. Collins? Mr. Collins, no. Mr. Byrne? Mr. Byrne, no. Mr. Newhouse? Mr. Newhouse, no. Ms. Slaughter?
Yes.
Ms. Slaughter, aye. Mr. McGovern? Mr. McGovern, aye. Mr. Hastings? Mr. Polis? Mr. Chairman?
No.
Mr. Chairman, no.
Clerk will report the total.
2 yeas, 9 nays.
Amendment is not agreed to, not agreed to. Further amendment or discussion, gentleman from Massachusetts recognized.
Mr. Chairman, I have an amendment to the rule. I move the committee grant H.R. 3762 an open rule so that all members, Democrats and Republicans, have the opportunity to offer amendments to the bill on the floor. Hope my colleagues will support it.
Okay, further discussion? Seeing none, the vote will now be on the McGovern amendment. Those in favor signify by saying aye.
Aye.
Those opposed, no. No. No
As for
vote.
roll call.
Gentleman asks for a roll call vote.
Ms. Fox? No. Ms. Fox? No. Mr. Cole? Mr. Cole, no. Mr. Woodall? Mr. Woodall, no. Mr. Burgess? Mr. Burgess, no. Mr. Stivers? Mr. Stivers, no. Mr. Collins? Mr. Collins, no. Mr. Byrne? Mr. Byrne, no. Mr. Newhouse? Mr. Newhouse, no. Ms. Slaughter? Aye. Ms. Slaughter, aye. Mr. McGovern?
Aye.
Mr. McGovern, aye. Mr. Hastings? Mr. Polis? Mr. Chairman?
No.
Mr. Chairman, no.
Clerk will report the total.
2 yeas, 9 nays.
Amendment is not agreed to, not agreed to. Further amendment or discussion? Seeing none, the vote will now be on the motion that was made by the Vice Chairman of the committee, Mrs. Fox. Those in favor signify by saying aye. Aye. Those opposed, no.
No.
The ayes have it, the ayes have it. And gentlewoman asked for a roll call vote.
Ms. Fox?
Aye.
Ms. Fox? Aye. Mr. Cole? Mr. Cole, aye. Mr. Woodall? Mr. Woodall, aye. Mr. Burgess? Mr. Burgess, aye. Mr. Stivers? Mr. Stivers, aye. Mr. Collins? Mr. Collins, aye. Mr. Byrne? Mr. Byrne, aye. Mr. Newhouse? Mr. Newhouse, aye. Ms. Slaughter? No. Ms. Slaughter, no. Mr. McGovern? Mr. McGovern, no. Mr. Hastings? Mr. Polis? Mr. Chairman?
Aye.
Mr. Chairman, aye.
Clerk will report the total.
9 yeas, 2 nays.
The motion from the gentlewoman passes. And the gentleman from Georgia, Mr. Woodall, will be handling this for Republicans. And Mrs. Slaughter for Democrats. I would like to say that the crack member from Massachusetts and from New York is correct, that we do anticipate having another meeting this week. Can't say for sure, but Louise, I promise that I'll give you a call as soon as I know, and we would schedule that as quickly as possible to achieve the things which would help us out. I want to thank the committee and the staff for their great work today. Thank our visitors from the great state of Iowa who've taken time to be here with us, the gentleman from Texas Tech, and this now ends the work for the day.